Okay, so today we'll try to understand what hernias are. Hernia is basically when an organ protrudes through the wall of the cavity that contains the organ. So basically when the fat or intestines come out through walls of the abdomen and forms a bulge, that is basically what a hernia is. So there are different types of hernias. The most common hernia is an inguinal hernia, which is found in the groin. The other types of hernias are incisional hernia. So you can develop hernia through previous surgical scars, which are weak, so that can form hernias. There are also umbilical hernias, which are hernias protruding through the belly button. Yes, all hernias need to be treated in most cases. Unfortunately, there is no medication for hernia. Hernia is a mechanical defect. It is basically a hole in the wall which contains the organs. And the solution for hernia is also a mechanical solution which involves surgery. So the surgery is done to close the defect in the wall and reinforce it using a non-absorbable mesh. Why should hernias be fixed? Because sometimes the organs, especially we're talking about intestines, which protrude through these defects in the wall and come out and form a hernia, sometimes they can get stuck. So usually they come out and they go back in. But sometimes a complication called irreducibility or obstruction can happen when they come out and get stuck. And if they're stuck for a very long time, the blood supply may go off, the intestine may necrose and die, and you will end up in an emergency situation. So it's important to get all the hernias fixed. The symptoms are, you will usually notice a bulge. These bulge usually increase when you cough or strain, and most of the time you'll notice that they go back inside on their own. If it does not go back, the bulge remains, or you develop any pain or tenderness over it, then you should rush to the hospital immediately because it can indicate an obstruction. The bulge is usually in the groin or the belly button or through a scar of a previous surgery. What causes hernia? Hernia is basically weakness in the wall of the abdomen. This could be because of aging or any injury, any previous surgery. Also, smoking can cause weakness of the abdomen muscles, which can predispose to hernias. Any chronic straining, anyone with a long-standing cough or patients who tend to strain while passing urine or having a bowel movement are at higher risk of developing hernias. Also, hernias are more common after pregnancy, especially the umbilical hernias. Most of the hernias can be fixed laparoscopically, meaning you will not have a big scar. There will be a couple of small half-centimeter cuts on your abdomen. Through the laparoscope, we will close the defect through which the organs are protruding, and we will place a non-absorbable mesh to reinforce the correction. With the mesh placement, the chance of hernias recurring are exceedingly rare. It's less than 1%. In some certain indications, you might require an open surgery to correct the hernia. So hernia surgery is typically a daycare procedure. Again, if it's done for elective hernias, you will have to come in with overnight fasting on the day of surgery. Once you undergo the procedure, we mostly discharge the patients on the same evening. If they're not very comfortable with that or they request for an overnight stay, then we discharge them the next day morning. So the post-op recovery, there is no diet restrictions. You will be able to do all your daily activities on your own. You can resume work within a couple of days. We would maybe suggest you avoid strenuous activity for a couple of weeks after the surgery.